Good afternoon, everyone. My name is Aneshka Ponce, and I'm presenting with Dylan Nicholas. Today, I'm here to present the findings of our heuristic evaluation of the CDC.gov following its 2023 redesign for the Clean Slate initiative. Our evaluation looked at how well the site meets users' needs, especially for people trying to find public health information. The agenda is as following: their introduction, the purpose and context, key findings, the recommendation, the impact it has, and what's next. Before we get into the findings, it's important to understand why the CDC website undertook the Clean Slate initiative in the first place. By 2021, the CDC.gov had grown to more than 200,000 pages. It had become overloaded, cluttered, and in many cases outdated. During COVID-19, users reported that it was hard to find clear, timely information, which is especially dangerous during a public health emergency, such as COVID-19. As a part of a broader modernization effort, CDC launched the Clean Slate to streamline the site and improve navigation and strengthen public trust. Over 65% of the content was removed or archived, leaving only high-value, high-demand information. The redesign brought simpler menus, better labeling, faster searching, and the usability scores improved a lot, with 90% of healthcare professionals now saying that site is much easier to use, and the new systems allow for faster, more consistent updates, which is critical when delivering urgent health guidance. In short, the Clean Station initiative about making the CDC.gov a cleaner, faster, and more reliable public health tool, especially when people need it most. The purpose of our findings was to mainly focus on accessibility, clarity of language, the visual feedback, and ease of navigation on both desktop and mobile. While the redesign aimed to simplify the site, we found several usability gaps that could prevent people from quickly accessing critical health information, particularly during emergencies. My goal today is to walk you through our process, highlight the most significant issues, and share recommendations that can make the CDC.gov more intuitive, accessible, and inclusive for all users. Why this matters. The CDC.gov is one of the most visited public health websites in the United States. Millions rely on it daily to get timely, trustworthy information about diseases, prevention, and vaccines. During public health crises like COVID-19 or monkeypox or mpox outbreaks, the site becomes a lifeline. But when users can't find what they need because the search tool isn't helpful or the language is too technical, the consequences can be serious. This isn't just a design issue, it's a public safety and trust issue. People come to CDC.gov in moments of uncertainty, often under stress. The site should make their path to answers fast, clear, and frustration-free. That's why our evaluation is focused on practical, user-centered improvements that can have immediate impact. The picture that we've shown here is the monthly visits to the CDC website during, especially what I've highlighted is March of 2020, when it hit an all-time high of 1 billion site visits. Our methodology was to evaluate the site, and we used Jacob Nielsen's 10 usability heuristics, an industry-recognized framework for identifying common user experience problems. Both members of our team performed a series of real-world tasks, such as going through the website for searching for vaccines, specific disease prevention pages, using the site filters to narrow down results, and we compared our findings to find a reoccurring pattern. And our approach was to design how an everyday user would approach the site, particularly someone without a medical background, because that is the core audience that we are trying to reach out to. Our key findings, such as this one, is the feedback problems. Our major finding was that the search function doesn't provide helpful feedback. When users type uncommon or slightly incorrect terms, for example, allergy vaccine or climate illness, they either get unrelated results or empty pages. There is There's no message like no results found, no suggested alternatives, and no related topics to guide them. In the picture shown on the slide, this was when I was looking for something specific. This was the error page that I got. In usability terms, this violates the principle of visibility of system status. Without clear feedback, users don't know if the search was processed, if their wording was the problem, or if the CDC simply doesn't have relevant information. During health emergencies, this uncertainty could mean delays in getting critical information. Our recommendation here is straightforward. Add predictive search results, clear error messages, and did you mean prompts to help guide people to the right context. Technical language. Over technical language is a big issue that we found, and it was one of our major findings. The CDC government website often uses highly technical or bureaucratic language without providing plain language explanation. For example, on the figure shown in the slide, um, Mpox pages or monkeypox, you'll see terms like immunocompromised populations or mucocutaneous lesions. These may be accurate for healthcare professionals, but for general public, they can be extremely difficult to understand, especially during moments of stress. This violates the usability principle called match between the system and real world. In other words, speak in the user's language. The problem isn't just about word choice, it's also about missing aids like hover over definitions, glossary links, or plain English summaries at the top of complex pages. Without those supports, users may misinterpret information or leave the site to search elsewhere, which risks them finding less reliable sources. Our recommendation for this is to add plain language summaries, quick definitions, and linked glossaries across key finding public across key public-facing pages so that everyone, regardless of the background, can clearly understand and act on CDC guidance. I will now pass on to Dylan Nicholas presenting with me.